Yeah, it can definitely work for you. There's a lot of things that can be your main problem. So if you're having low back pain, that can be something that can actually be debilitating for you. Hard to get out of bed or hard to get to sleep at night. And so chiropractic really helps make sure that the muscles and the joints are working well together. So that as your body's functioning better, you feel better. And the same goes for if you're having headaches. Like sometimes those headaches can be enough that you just can't focus or keep track of how things are going for you. And chiropractic can help those joints function better so that you're functioning and feeling better. Yeah, there are all kinds of age ranges. Sometimes we'll even adjust newborn babies. I adjusted my baby a couple hours after he was born, and so that's typically most people don't need or have problems at that point, but if you know what's going on, you can kind of address problems earlier on. Colic would be something that might be helped with chiropractic, and or potentially even digestive issues. As long as the joints are functioning well, the nerves are functioning as they should be, and then the body can function as it should. So we can go anywhere from newborns to, I've adjusted, I think he was 95. I think he was 95 years old. Definitely the adjustments are different for a newborn and a old senior or someone in their mid-20s or 30s. So it just depends on what's going on, what the cause is, and what works best for that patient. Pretty well anybody can benefit from chiropractic. Yeah, there are a few side effects or a few side things that wouldn't work for chiropractic, but those are things we'd find out in the exam. The thing that makes me different from other chiropractors is I deal with physical therapy and chiropractic together. So it's not just come in and get pops, get your joints functioning better, get your muscles feeling better, and get out of here, and eventually the pain's going to come back. We work on functionally training the spine so it's positioned better and curving more like it should be. Scoliosis is a typical case we'll see where the spine is actually causing the problem. So your muscles are always going to be chronically tight. So we actually work on structurally moving the spine so it's straighter and it's healthier. So that's a different thing that works that I do compared to what other people will do. So the benefit would be that we're working on muscle and joints together and not just one kind of here and one kind of there. We'll work on both those things together so you have a long-lasting effect that's lasting more than just a couple of days or a couple of weeks or if you're lucky a couple of months. This is something that can change for ideally the rest of your life. So it's intended to be a lifelong change for you. So you don't have to keep going back to chiropractors and keep going back to physical therapy or keep getting massages. Your body can just be better and healthier. We want to get you off of pain medications. If you're dependent on pain medications, those things, yeah, they feel better. They help solve your problem temporarily. It's kind of like a Band-Aid though. You're not solving the root cause or what's really causing that. Pain is basically a symptom that you feel because of a problem going on underneath. So if we can get you off of pain medications because we're actually fixing the root cause of the problems, then great. We've solved more than one problem. We solved both your health and your future health because of the pain medications and how those things can affect you. Especially with ibuprofen, it'll affect stomach ulcers and other internal organs. Pain is your body's way to feel things when there's a problem. Like if you've pulled a muscle, you've strained a muscle doing some sort of activity, or you rolled an ankle, that is pain. So your body's telling you, you have a problem and we need to fix this in some way or another. Sometimes that is fixed on its own. Sometimes an ankle will resolve on its own after 9 months. Sometimes it resolves faster with chiropractic care. So pain is just your body has a problem and we need to figure out what it is. That's kind of a fun question because I was anxious about medical things in general. Like I hated going to doctors. Like doctors are just there to take your money and give you a pill and Band-Aid a problem. Then you come back when the problem's worse and then they give you another pill. So yeah, what I do is I walk through people and I give them step-by-step, like, are you okay with this? This is what we're gonna do. I set things up with you, make sure you're all right with that. If it's not okay, then we'll try something else. And we can try at least 3 different ways that we can go through things, and we'll start with the most aggressive or the most effective one, but I'm also gonna make sure you're on the same page, that you're aware of what's gonna happen. And if you wanna back out at any point, great, no harm, no foul. So No hesitation as far as things go. I try to make things very clear up front before we do anything. Every patient's treatment is depending on their health, their problems, and what their x-rays look like.
With the ultimate goal of
Getting out of pain essentially lifelong.